If you're an employer and your employee cannot show up because have dental issues, you lose. If you are a instructor, you are a teacher, your kids, they're not showing up, you lose. But if you're on Denti-Cal, of course, 100% I can tell you, and the funny thing is happening kind of hush hush, this thing. Nobody's telling anybody. But when I told the patients, I said, really? We didn't know that. I said, well, that's when happening.
Awesome. I'm super excited because like I've never had a doctor on the show. So for those people watching, your name is Kushan
Kushan.
Azad.
Yes. Perfect.
Okay, perfect. I'm going to practice it a little bit more afterwards just to make sure I get it because I'm going to talk about you a lot.
Sure.
But just so those listening and watching, you want to introduce yourself, just a quick second or two?
Sure. Well, thank you for the opportunity. My first name is Kushan, just like Sean with a Ku, Kushan. Last name is Azad. I am a general dentist. I graduated 28 years ago. I've been doing dentistry that long. I would say in the last 15, 16 years of it, it's been more of multi-practices. And I would say probably if I go further back, but last 20 years, really focusing on bringing dental services to underserved, blue collars areas that typically many dentists, they don't want to operate from. And nothing against that, it's just harder. I'll be doing that proudly, and has been great.
Okay. I'm trying to think of what questions I have personally about dentistry. Am I saying that right? The art.
Yep.
Okay, dentistry. So me growing up, I was always taught in school certain things to do. If I did, not going to the dentist, when you take a swig of water, you swish it around your mouth. Like let's say you didn't have a chance to brush your teeth, you swig it around your mouth, and I was told to then swallow it. And then now as I'm older, I'm told to swish around and then spit it out. Like, that's just like elementary school me going, okay, so what is the spit it out, keep it in your mouth,
Sure. I mean, actually, if you don't have a toothbrush handy or you're not in a position of doing that, definitely rinsing your mouth, swishing around is a good thing. It's always better to spit it out because, don't forget the mouth is a lot of bacteria in there. So that's what you're trying to get rid of, some debris and bacteria. I mean, it's not end of the world if you swallow that. It's just your own body's bacteria, but you better, if you have an opportunity to spit it out, you can spit it out. So you shouldn't be swallowing it, but it's not end of the world. If it's just water and you're just swishing around your mouth and you swallow that, nothing major gonna happen.
Yeah. Okay. That makes
But it
sense.
doesn't replace brushing, though. I mean, you still have to brush.
Oh, of course. Yeah. So before we started recording, one of the things I mentioned was when I first drive off of Crescent into the plaza, I noticed a new dental office taking over a couple offices, right? It's in and to me, I told you right away, is like I'm really one of those guys that like to notice things that like are really in your face. So the fact that you're right there and people are driving up, does that help business, like placements on where your office is?
Definitely, it does make a difference, especially at the beginning when you wanna have the most exposure. So just like yourself, if you noticed us,
Yeah.
that's a fact. However, as the time goes by, especially when you're in a smaller communities, they know where you are. The community knows where you are.
Yeah.
So it becomes less of a factor. But for sure, the first couple of years, it definitely makes a big difference if you have a good exposure.
And I want to go back a little bit. What made you start being a dentist? What made you start? What childhood memory do you have? So what made you go, is like, out of everything you could have done in the world?
Why dentistry? Right?
Why? Yeah.
Why putting my hands in somebody's mouth?
Mm-hmm.
I would say I wasn't one of those that growing up and say I absolutely want to become a dentist. So maybe I take a little bit step further back. As an immigrant, I was born, and up to my teenage years, I was in Middle East, in Iran. Typically, that science educations in Middle East is very strong. So it came, when I left with at 15, had a very strong physics and math basis. And obviously, as an immigrant, when you come, you don't speak the language. The only really things that I really knew was math, physics, chemistry. That didn't, there's no language barrier to that. So long story short, when I finished high school and wanted to do something, for me, the natural choice was engineering. And so I went to engineering, and there was a program I chose. It was a mining engineering, and it happened to be a co-op program. So I was alternating between basically school and going and work in a mine.
Okay.
So one of my first jobs, I worked in an underground mine, about 4,500 feet underground, which I didn't mind that part of it. The problem was that, just the whole dynamics of, thinking of, okay, well, what I do really want to do this? And it's say if something becomes more personal, I needed to see more people, and, there's a lot of isolation there, and, the air is not always the best. And so I started, actually around that time, obviously it's not in the same city. I was start dating my girlfriend then. She was just starting dental hygiene program, and I was talking to her, and I said, you know what, I don't think I'm gonna like this. I'm probably gonna go and do something else, maybe computer engineering. Don't forget, this is the early 90s. Maybe I do go to computer engineering or something else. So, well, why don't you become a dentist? I said, no, I don't know. I mean, to be honest with you, I didn't have much culture about dentistry. I said, I don't know if it's going to be for me. I mean, working. I said, oh, well, you're good, your manual things. And, I was a little bit artistic here. I said, well, you know that, and you're not bad in science. But I said, but I've never really gone through biology. So long story short, I said, why don't you give it a try? So when I finished my work term, I knew one of my buddies, the brother just graduated dental school. He was working as a young dentist. I said, do you mind asking your buddy if I can go and observe half a day, once a week? Wednesday afternoon, I had time. I had no class. I said, sure. He asked him, and he said, no problem, come. And I tell you, I fell in love with it. And I watched that. So I had to work very hard for the next couple of years to get, the top grades and getting ready for DAT and all that stuff. And the rest is history. I married my girlfriend. She's my wife now. I've 34 years, gonna be this 1994. So 32 years, excuse me. 34 years we're dating, but 32 years we've been married this summer with 3 kids later, and a great life together. So it's thanks to my wife. I always tell her that you custom designed me. You wanted to marry me, but you wanted to marry a dentist. So
Yeah.
she put the two together.
That's
And honestly, I
very
really
smart.
loved it. Yeah. So
Yeah. It's funny because I thought you were gonna say it's like, oh, well, you're already drilling, and why not drill teeth?
it's
Like in my
actually a
head
good
went that
point. That's
way.
what my late father he said, because when I told them that I think I'm gonna apply for dental school. I said, well, the only common thing I see is just drill, just the
Yeah.
side of a drill. Mining, engineering, dentistry, two different things. But um, I think engineering gave me a lots of tools, because I finished that mining, and it made me a more of an analytic mind, and it really helps because a lot of my classmates, they all had undergrad degrees, because you have to have a degree anyways in biology, biochemistry. And I was kind of envy them and say, oh, these guys, they did so much more. I just did the minimum basic to apply to dental school. And but as time went by, and especially when I graduated, started working, and so my God, engineering really prepares your mind, the way you think, the way you see the problem, the way you analyze that, kind of makes things, to be honest with you, clear for me. So
Mm.
I apply that, even to this day when I run the business part of it.
Yeah. I can see that. Like I know when people I mean, I didn't go to college, so I can't speak for a lot of people, but it's like one of those things where as long as you learn something out of it, like, obviously the paper is going to help you get a job or not, right? In today's world, I was talking to somebody, like, what does it cost to, like, how much money should you make to afford health insurance? And somebody said like $75,000, right? And I'm like, how many degrees actually get you that type of job, right? So as long for me, it's like as long as I learn whatever I'm doing and get something out of it, that's amazing. So the fact that you're using still every single day, it's it's impressive. Like there's people that go to college and come out of it and like don't apply anything they use. All they have is a piece of paper. I'm not saying it's like college is bad, but I'm just saying like apply it.
Yeah, that's probably a long conversation
Yeah, it's
about
a different
college, how I
conversation.
feel about it, and
Yeah.
these days, especially how much it costs and
Yeah.
what you learn and what you really don't learn. That's it. I'm with you on that. But the reason, I think is just because it trains engineering. I wouldn't remember if you give me bunch of those, mathematical or physical, I wouldn't remember anything, but it's just the analytic thinking. If when you have a challenge, you start putting it on a paper or how you look at it. I'm still a pen and paper type of guy. Okay, these are the issues. Okay, what are the solutions? And these are
Yeah.
A, B, C, and D. Which one works gonna be better? So the path forward. And I in business of dentistry, which becomes a huge business, with all the great patients that you have to make sure the compliance, the quality, the doctors, they work there, the supporting staff. So you have to have lots of plannings. You have to have, making sure, what works and what doesn't work. Ultimately, always the goal is the patient best interest, but to get there and make sure that it works, sometimes there are some challenges that you have to make sure you do it. And that's what the engineering brings it.
Got it. Yeah, no, I agree with you there. Yeah, I can't wrap my head around what might go in that world, like in that industry, and like I barely have a tough time managing like 25 employees at a movie theater when they're all mostly just all part time. I can only imagine you like actual clients and staff, and I'm guessing the whatever medical entities out there making sure you're doing everything right.
Correct. Yeah. Well, we have basically, so on one hand, we have what is the most important, right? They're the patients that basically um, we have to see them. We have to do our best to give them the best care. So that's the end goal. Now, obviously, we have regulatories that they have requirements that you have to make sure that you do everything by the book, and you have to make sure. Because if I'm not seeing patients, and we have associates that we really go through lots of steps, making sure that we hire the best associates and that they're really qualified. They can provide dentistry at a high quality. They have professional chairside manners, and they can be efficiently working with patient, not keeping them for 3 hours. Something can be done,
Yeah.
in a more efficient way. Nobody wants to come more often than they should at dental's
Right.
office, and nobody wants to stay there longer than they should. So managing that and having a tight compliance program to make sure that all your doctors on the same page, that's important. Then obviously, as you know, and God bless California, we all live here, and how it is in terms of employment and employee rules, and making sure that
Yeah.
everybody's treated and the fair way, the right way, and everybody gets that. So that's obviously, this is not a one-man show. I have
Right.
a few people that around me to help me out, that probably better minds and better at doing this the day-to-day operation than me.
Yeah. So one of the things okay, so you're telling me what you do to take care of the patients and your staff and keeping them happy. We have one right here. She seems really happy.
It's more of a contractor.
Contractor? Okay. Oh, perfect. One of the things I wanted to ask you is just so people get a little more information too, is why does routine dental care so important? Like to go, because you just mentioned not everybody wants to go. So why is it so important that they must go, especially if it's covered under the insurance too? By the way, just take advantage of that.
Sure. That's a good question. Well, when you get a routine dental care, so actually, let me take a step back. When you go to see your primary physician, right? Primary care physician for, they say, annual checkup. I mean, I don't know, everybody goes, but probably people, they go more often to annual checkup because if God forbid something wrong. I don't know of any internist, any family doctor, they're gonna say, open your mouth, let me check your, gums, or let me check your teeth, and let me have a look at, let me take an X. They're not gonna do that. So you don't have any other professional to have a look at your mouth. And what happens in the mouth? Number one, it gets really abused every day because we put hard things, soft thing, sticky thing, sugary, hot, cold, and so it gets a lot of it's designed in a way to uphold those things, but you have to maintain it. So imagine you have a car that you use it all the time for work, because this is how we survive.
Mm-hmm.
you know we don't survive with an IV. So it's to the mouth, right? Since day one we are born, we know this is the most sacred because that's how we survive. We learn that, and so forth until our end of our days. This is how we get the energy. So what happens if you get proper routine care, because you can simple things that if something is broken or something, basically if you have a decay, that can be, you don't have necessary pain, but lack of pain doesn't mean the lack of problem. Otherwise nobody would ever have a heart attack because they would have pain and they would not take care of it. And they would have an aneurysm because they would have pain. So lack of pain doesn't mean lack of problem. So that's one thing. A lot of basically more systemic issues like precancerous cancers, that first sign shows up in the mouth, and doctor can basically we do a cancer screening when we look at the mouth and we check those things. Obviously, thank God, not doesn't happen often, but we do see them and we take biopsies and do that. But more common, if you have gum problems, that basically a routine checkup, basically you can take care of those, because otherwise they can affect other part of your body. So many benefits.
Yeah, I've heard of, I would say, worst case scenario stories where a cavity just grows into something else, and that goes directly into the bloodstream, right?
Correct. So teeth are no different than anywhere else in your body. So they have blood supply and they have a lymphatic system, except that the tip of the tooth, the apex, is very, very tight. So teeth get inflamed. That's where what we call it, the two things we could either reversible pulpitis or irreversible. The reversible pulpitis is when you say you have something like, for example, you have something sugary or cold. So, I feel something.
Okay.
That means you might have a cavity, but your nerve, which is inside, is inflamed, because inflammation is something that, in fact, if it's acute, is good. Acute inflammation is, you need that, because that's how you send all those, fighters to fight it. But the problem with inflammation, it become a chronic inflammation. That is bad. No chronic inflammation is good anywhere. So what happens is this gets inflamed. So if you take care of it, and if it's not too deep, you remove the decay and replace it, and it comes down. We call it irreversible pulpitis. That means it's so inflamed that eventually it's starting to die off some cells, and the pain is typically gets to heat, not too cold, because the nerve is starting to die. And at that time, you need a root canal if we can save the tooth.
Got it. So I have an interesting question. I don't drink as much as I should, and as much as I should, I have before. I have 2 kids. I make sure I take them to school, pick them up. So in my head, I'm like, there's no way I'm drinking at any point when I'm with them, right? So that almost means I'm sober. But the times I have had a alcoholic drink, maybe a couple beers in, and let's say I have water after that, I feel like a sensation in my mouth where it doesn't hurt, but it's like what's the way to explain it? Kind of like a suddenly sugary sweet or whatever, and like kind of like quick
When you have the beer or when you
after.
really?
Yeah,
Interesting.
yeah,
I mean, I can't say what would I think if we have beer and then you have, because sometimes the temperature of the body is colder, so you could definitely feel that. Because if anything, when you have water, kind of washes things away, so it's not a bad thing. But if the temperature, if you have something in terms of basically in your teeth, in terms of incipient decay or some sort of it, definitely cold water can treat.
Yeah, because I feel like it's a temperature thing, because I mean, it's happened since I've been 21, so it's like since I've been drinking at 21.
Have you gone to a dentist lately?
It's been a while. I'm gonna say that I'm a little embarrassed to admit that, but it's been a while. And I guess that's where my questions come up, is like, I mean, I haven't been to a dentist. I can't ask anybody that. But one of the things is, we talked about root canals, right? Why is it so important to catch it early on these things? Can you expand a little bit more on that? Because I know there's a lot of people like me who aren't going.
Sure. And when I understand, like I said, remember at the beginning, I just said a couple of minutes ago, it's the most sacred part of our body. We don't think of it.
Yeah.
To go and allow somewhere else to start, trust them with your mouth, and when you have sharp instruments, needle, instrument rotating at 20, 30, 40,000 RPMs, putting your mouth, it's not something you kind of lose kind of control. So you have to give full trust and keep it open for a little bit. So there's nothing fun about it. And we can call it a dental spa and always say you can put a waterfall and bird
Yeah.
chirping. You can make it less, stressful. But at the end of the day, it is what it is. I mean, that's something that, I can confess, I'm not the best patient myself. If somebody else wants to make my part, I'm a little bit stressed. But, I understand I have to do it. So the idea is you want to avoid root canal. Sometimes you have a root canal because you had a trauma, like something fractured. I mean, you hit something or you hit something very hard. That's sometimes you can save the tooth with a root canal. Sometimes you can't. You have to, unfortunately, take the tooth out. But at the end of the day, one thing I always want everyone to think about, your teeth are no different than your fingers. You don't want to take the nerve out of your finger, or you don't want to cut it either.
No.
But you want to make sure that you keep them. That's it. Your teeth are there. There's a reason your teeth are there. There's a function to them, and you have to do your best to keep them and to keep them intact. So that's the reason you want to avoid the root canal, because once you do the root canal, it's not end of the world, but the tooth has no nutrition, so become more brittle. So it become more brittle, and it can break, and it can have, it's more prone. That's why when you do the root canal, typically, it's followed by post and a crown, which covers the tooth, so to better distribute the force, so you won't fracture.
Okay.
You don't want to do a root canal, just leave the tooth as is, because it's going to become a lot more brittle and it's going to fracture. It's like it's like a plant, right? If it's a dead plant, you can crack the branch. If it's not, it can take some moving around, and that's what you eat. It's the same thing.
Interesting. See, like I didn't even think about that way. So you're talking about like machines going near your mouth, and that's our brain when we're like sitting there anticipating, you working on the mouth. That's our brain going on survival mode, right?
Well, 100%.
Yeah.
Because the only thing naturally should go in your mouth is something for you to survive, something to eat. You're not gonna. So now, somebody else putting some sharp instrument in my mouth,
Yeah.
nothing good gonna come out of that. And unconsciously, that's what you think.
Yeah. That's interesting. It's interesting how many things can go to like how we survived as like a young species. That's crazy, man. All right. So I got another question for you. How does a visit to the dental office compare? Okay, hold on. How does a visit to a dental office compare to a tooth-related hospital emergency room visit?
That's another good question. So, when you have a toothache, and it could be because it's like 8 p.m., you don't have a dentist of record, or it's on a weekend, and what are you gonna do? I mean, it's not like basically you're not gonna find, if you have a dentist of record, we have emergency service and all that. If we don't have that, or you wanted to avoid, and this is not a judging thing. I'm just saying what happened. Typically, what happens? Oh, dentist is expensive, or so I can just brush and floss, and I can deal with it, and the pain is gone now. And then you come back with a vengeance, right? Typically, Murphy's Law is going to come at midnight on a Saturday. There's nothing you can do. So where you go? I mean, typically you go to an ER, and that's a natural, something wrong with your health, and you should go to ER.
Yeah.
And surprisingly, I wish say surprisingly, it's a fact. I know I'm not surprised, but I don't know why it hasn't changed. For some reason, we separate mouth and teeth from the rest of the body, right? Even in the insurance coverage are two different things. Or do you have medical? Or do you have dental? It should be the same. So do you have basically something to cover your ears and your fingers, or that's separate? No, I mean, it should be part of what it's not. That's a separate story. Yeah. So they go to the ER. I don't know any ER that would have a dentist a resident. There are no dentists. So what happens is they're not equipped to deal with oral, pain or the tooth-related thing. So what happens? If they see you have a big infection, they're gonna put you on IV antibiotics. If you have, they give you some painkillers. So there's no definitive treatment. So this is that you're not gonna get a definitive treatment. You're just gonna get some pain relief, or if you have a major infection, because that happens and then goes to your body, it's just dangerous. They may get you on IV. So that's the most they can do. In terms of cost, typically a visit to a routine visit, even emergency visit. Imagine if you go an emergency visit, it typically could be anywhere from 100 something to maybe $400-$500 if you needed a root canal. If you need a crown, another $500-$600. It's typically not much. I mean, this is more definitive, and you're done,
Yeah.
and all that. Plus, you get the example, other things. There, it probably starts from $1,000 just to say hello. If you're admitted,
Yeah.
it could be from 1,000 to 3,000 because depending of what they did to you. And if you're admitted, good luck. It's 8, 10, 15, 20,000. I mean, just insane. So that's the biggest reason I see. A, you don't get any definitive treatment. B, it costs a lot more. And so
Yeah. I'm actually really curious. Why is it that health insurance isn't automatically covering dental? Like, what's the history behind that? If you know it, and you,
I don't know exact history, but I know the insurance company is all about making money.
mm-hmm.
And historically, I mean, I was one of those before I went to dental school myself. People, they don't go to the dentist often. So, okay, well, and the common thinking was it's not as important, right? I mean, more and more we see that's not the case. So let's separate those because, in medical, I mean, the budget is so much more, right? And you can go and visit or anything will be in thousands of dollars. Dentists, typically most insurances, they have an annual limit of $1,500 or $2,000 or $2,500, unless you're an executive at a company, typically it's a lot less than those annual limits. And I think it was more to save insurance companies money. I don't think there's anything. I hope they're not gonna kill me when I walk out insurance company.
No, I think we're good. I mean, this
I'm
place
just
is hard to
joking.
find to begin with. So
No, I'm just joking. But I mean, honestly, I don't know. I mean, because I'm always in an aha. So why? I mean, and California Dental Association, American Dental Association, they're trying to change that. And collectively, we're trying to change that. Your teeth are no different. Your
Yeah.
oral cavity is no different. It's just part of your body. It's integral part of your body. And many things from your mouth can affect your whole body too.
yeah,
So it shouldn't be separate, but it is.
yeah, but it is, and that's the weird part I've always found fascinating, especially when I hear all these like. I don't hear a lot, but I know the reality is if something happens to your teeth, it can affect you in a way where it can lead to death. You know, I've
Absolutely.
heard those stories.
Absolutely.
And one of the things in my head is like, okay, so here's another thing. I've never had a cavity in my life. I don't know if that's impressive or not, but I remember my family that would go and they would always come back out. I was like, oh, one, two, I'm over here like none. So I thought it was, is there a just genetics go into that? Like, is that a
There are some.
factor?
There is some genetics, and I think the biggest one, unless some people that don't have some specific disease can affect, the calcification of your teeth. So that's, that's separate. But overall, your saliva, the acidity, the pH of your saliva kind of defines a lot of those things. Cavities that they kind of grow in a very acidic environment. So that means people, they have more acidic, basically, mouth. Some, a lot with diet, but also some naturally they have that, or they have less saliva, basically production. They are more prone to get decay, even if they consume the same amount of sugar as others. However, as you get older, you're gonna be more, those who do not have often cavities, that means they have more of a alkaline, a basic pH more than 7 and up, they're a lot more prone to have gum disease, which is probably worse than a cavity. Because cavity, I can tell you why. Because what people, they don't think about it, the way a tooth stays in the bone structure, like in the alveolar socket, it stays there within ligaments that is holding in place. I mean, if you take a microscope and look at it, that's how it is. So you need that bone support to keep a tooth in there, right? A gum problem, what we call the gum problem, is really not the gingivitis. If the gingivitis is just the gum, but really periodontitis is starting to affect the bone underneath. So that means compared to a house, cavities, we can be a door issue, a window issue, maybe a roof issue. They're very important. You have to repair it. Gum problem is a foundation issue
Okay.
because you can repair that, but if you lose the foundation, the whole thing is gone. That's when you have to extract the tooth. You can't do much about it.
Well, yeah, I just felt a big old gulp down
Well,
my
I'm not saying that is your case. I'm just saying that
Yeah.
basically, many people that don't have cavities and they don't have any,
Yeah.
gum problem either. If you have good oral hygiene and if you typically, as you mentioned, if you have anything sweet, definitely if you have, it's not always handy to have a toothbrush and toothpaste as soon as you have something sweet. But if you can follow it by nuts or cheese, it reverses the acidity, the pH. Because you have sugar, and that's one of the reasons when you have sugar, it really makes a very, a very acidic environment. Plus, the bacteria they use that as also, as food. And
Yeah.
what that's where it's starting that acidity start eating up your teeth. That's what happens, and that's how the cavity happens. Without going to the details, but you can if you have nuts or basically cheese, it kind of reverses back. And if you rinse your mouth, obviously it always help. So
Yeah. Yeah. And as a fun fact, I didn't have a lot of candy growing up, and I love cheese.
there you
I
go.
love cheese, so that probably helped
That
out.
could be part of the
Yeah. That could have been
reason.
part
That
of
could
it.
be it could be part of the
Yeah.
reason.
But now I'm still worried about the foundation. I'm like, I gotta go.
Floss is very important. Flossing, that's the way, because you can brush and floss, and if you don't floss, you're gonna have that sooner or later. You will get that gum issues. Flossing is extremely important. Once a day at night. You don't have to floss 10 times. Brush twice, even if you don't want to floss in the morning, floss in the evening, because when you sleep, obviously the way we are designed at sleep, there's no saliva production, right? Because otherwise we will
Right.
choke on it.
Yeah.
So when there is no saliva, they're anaerobic basic bacteria that they don't need oxygen. They grow. There's saliva saliva typically controls it. Saliva is actually good for us. And what happens? That's why in the morning we have all bad breath because bacteria grows. Now imagine you left some food for them in between your teeth. They're gonna have a fiesta.
Yeah. What typically what kind of foods are you wanting not to be in your teeth?
I mean,
Any foods
anything.
really.
I would say healthy diet is always a good thing, right? I mean, you don't want anything. But as far as because as in dentistry, I always want to promote healthy diet no matter what. Doesn't matter it's good for your teeth or not, because anything typically, but if you want to focus just teeth, definitely sugar is not a good thing, especially processed sugar, and it's when it's sticky. That because you can't really, there's some grooves in on your teeth that you can't get those things out, so they stay there forever, and that's where cavity starts. Anything too hard, we start chewing on hard candy or ice or pencil. These are as a big no because you can have those issues.
Yeah, I know a lot of people like to chew ice.
Bad.
It's bad, right?
Bad.
Yeah, so a lot of people have dinner probably right before they go to sleep, right? I like to think I have dinner probably a couple hours before I go to sleep. I'm still trying to figure that out with my kids because they're very picky when they want to eat and when they want to eat and what they want to eat. But they're very good at reminding me that they have to brush their teeth. So we get that taken care of. Is there a difference between brushing morning and evening or just evening?
Well, if you only had to brush once, if definitely will be in the evening.
Okay.
100%. Because of the same reason I told you, when you sleep, saliva is a protector. That protection is gone at night. So you leave those things for hours without any protection. That's nothing good comes out of it. The fact that when you wake up in the morning, you have bad breath. If you brush and you clean your tongue as well at night, in the morning you still gonna have bad breath, but not as much, right? You control the bacteria environment. So that's the reason. But brushing twice a day, that's a good thing. You can typically that's what it is. Flossing, I would say, as a dentist, I should say floss in the morning, floss in the evening. But if you don't floss in the morning, but at least floss in the evening, that definitely you want to floss in the evening. You floss first and then you brush it.
So you work on all ages, right? Kids to seniors. One of the things I've noticed is in the world we live in today, government is very much involved in what we're eating now. Sugar, processed sugar is. I mean, I remember growing up. Remember that pyramid of foods where the bread was like the most important one, and it's now the opposite. It's actually
Right.
protein and fats. Have you noticed a difference on how many cavities are actually showing up, or are you kind of still like
I mean,
noticing the
I
same?
have to say, unfortunately, when it comes to, well, you know, just caries itself is the most common infection among children.
Mm,
I mean, in the world, like anywhere. I mean, advanced country like us, you know, it's pretty much the same. And that's what it causes chronic inflammation as well, and we get into all that. I can't say that, you know, we have seen a major changes. I mean, I think we can take region by region areas that they have more access. You know, we cater lots of time our offices we go that we can try to help the blue collars and some underserved, you know, that we've done some school programs. And so, and these are, you know, our patients, many of them, unfortunately, they have lots of caries, what we call the high decay index. But, you know, typically the good thing is, you know, if it's detected early,
mhm.
and you build a, you know, a good experience for them, because it's not just when you see children, because we talked about children. If
Yeah,
you see
yeah,
children, it's not just, of course, it's very important to take care of the, you know, acute issue, right? The cavities or broken tooth or infection, you take care of those. But also, if you build the right experience for them, it will make them much more likely to go and see a dentist on a regular basis when they get older. So preventive is so important. You take care of the problem when they're younger, and it's going to be much less issues when they get older.
I know. Growing up, I had a lot of friends who had cavities, and it's very
Most all
interesting.
envy you, huh?
Yeah,
No
they
cavities.
no cavities. They definitely envied me. And even as adult, I would tell people that story, and they would be like, lucky you. But now you told me, gotta also make sure the foundation is good. Um, so with Cali Dental being here in Paso, what's who do you serve? Like, because I know we talked about ages right now. Like, you serve kids to seniors. Who's your ideal client? Like, what's your ideal client?
Ideal, I mean,
So they
I
want
don't
teeth.
anybody, anyone that needs any oral care.
Okay.
That's the, we don't have. So we have some, you know, we have rotating specialists two part. They come. We have a board certified pediatric dentist who comes twice a week. So he sees patients that, you know, our younger that, you know, otherwise our general dentists are not equipped. We have an orthodontist, and so we try, and we're gonna have an oral surgeon as of this summer for more company. Now, our general dentists, they're pretty well equipped to do most things, but you can be jack of all trades. There are some more complex. For example, if you have a child is too young, could be the best behavior, but you have bunch of cavities. It could
Yeah.
be 3 year old, and they have the best behavior. They can only have the best behavior with the first lesion you're gonna work on, because at
Yeah.
that age is this zero chance. It's not fair to the child
No,
either
no, no.
to get this. So those are should be done under sedation, and so forth. So we try to we are really a family practice from children, parents, grandparents will see. And if we can't really they come to we don't have the expertise, we happily, you know, refer them to, you know, other doctors that they can see them. But I'll do my best to make it a one-stop shop to bring all the
Yeah.
specialties under one roof.
Yeah, I mean, that's good. That's good. I just recently talked to a representative from Aflac, and they were not pushy, but they were telling me about the dental options they have, and I'm like, yeah, of course I'm going to add dental to my policy and stuff like that because health insurance doesn't cover everything. So it's good that Aflac is out there doing
Right.
some of the legwork, right? Um, what insurances do you cover when we're talking about insurance here? And then I want to ask you about Denti-Cal after.
Yes. Well, you know, Denti-Cal is a very large portion of patient we see that
Mm,
coverage. We do accept most PPOs. We don't accept any HMO. Just it's a completely different discussion for another day why I don't
yeah.
accept it. but most PPOs we do, and I would say majority of our patients that they have Denti-Cal coverage, government coverage.
Okay. I mean, that's good. That's pretty a good portion of the people here, right? And it's how is I'm terrible with health insurance. So expand a little bit more on those different ones, because if I'm going to you, obviously their health insurance is going to tell them who they can approach, right?
Correct.
What's it called? Outside the
Well,
network?
in
Yeah.
network, outside network. So
Yeah.
PPOs typically you're in network, right?
Okay.
It's a preferred provider, basically. So we enroll with, in these insurance companies. We typically, unless there's some, the only reason we don't enroll with an insurance company is that there's literally nobody in have that insurance coverage in a community, because the enrollment is a lengthy process that the team has to submit so many paperwork, and it's just not like I say, hey, I check that box and I'm enrolled. It takes a bit longer than that. Very rare that happens, but sometimes, because when you get all the list of this, and the other thing is basically that as there are some cases some insurance company that they make it so hard in terms of their fee schedule is something that we just cannot afford. It's not because we don't want to, because typically Denti-Cal is much less, much lower.
Yeah.
They give the minimum. They don't cover everything that they cover. They come the minimum, and we proudly accept that, and we do it. We make it happen. So we typically don't go and focus. Oh, this insurance. Typically, insurance companies are always much higher, but there are some unique exceptional case. So other than that, we enroll with most insurance companies that PPO. So typically, it will be very rare that somebody would walk into our door and say, I have insurance A, B, and C, and say, well, we don't know what it is, we don't cover it. Well, we are enrolled.
And is Denti-Cal in California becoming more popular, less popular? Like, how does that fit in the time frame of, like, in your career?
Sure. So Denti-Cal, as you know, is a part of the Medi-Cal, which is the Medicaid in California. California Medi for the Medicaid, Cal for California, so Medi-Cal. Any other state, they call it just Medicaid. In California, we named it Medi-Cal. Denti-Cal is basically, in terms of budget, it's about 1.5% of the entire medical budget. It's little, it's nothing. I mean, when I'm saying it's nothing, it's such a small piece of the entire, entire thing. And obviously, I'm opinionated about it because it's my passion, and majority of patients have that coverage. Denti-Cal was very, unfortunately, we didn't cover much, didn't cover any adults. The fee schedule was very, very low. So back in 2016, there was a Prop 56 was put to Californians and asked whether you would accept to be tax tobacco companies, and put in tax on tobacco excise tax.
Yeah.
And add temporarily, we're going to try to see if we can, because the access was limited, many dentists, and I don't blame any dentists, because at that fee schedule, it's not because you don't want to. Overwhelming majority of dentists, they're passionate, they want to help the underserved communities. But the reality is, our equipment, our payroll, our rent doesn't make a difference whether you see patients on Denti-Cal coverage or fee for service. It's all the same for, we have to pay that. So long as so short, that they did that Prop 56, 2016, they adopted that. It was supposed to be temporary, and it is expiring July 1st. And I can talk more about that, but so it did what it did. It really increased the access, including myself. I started opening offices where I can, we run these offices on a very, very small profit margin. We don't get any grant, zero grant. So they have to, we have to make a penny to keep it open.
Right.
So that's where basically where we are. But unfortunately, it's coming to expire of July 1st. Well, they didn't have to expire. That's what they decided. But there was another one called Prop 35, which I can talk more about it. It was actually put to vote back in November 2024. And overwhelmingly, I think 70% Californian voted yes, which this is permanent. It was supposed to tax some MSOs, that, insurance companies, the middlemen insurance companies, and take that, and they the question was really clear whether you agree that those companies get taxed, and the difference was only going to be used to increase medical provider, including dentists with Denti-Cal, medical providers reimbursement rate. Because even today, with the added Prop 56 extra tax, even today, is around probably anywhere between 50 to 60% of the typical insurance fees. So it's much less. But once that goes down, this fee schedule is gonna go back to 1990s, literally. So I always, when I make people understand, I say, imagine whatever industry you are in, right? What was the average pay in the 1990s, 30 years ago? Whether you're an engineer or you are basically managing a movie theater or a restaurant, whatever that was, imagine that's what they're going to pay you, but you have to live with the rent today, with the overheads today. It's just not going to work. I mean, it's the effectively, and I don't know their thinking behind. I don't think, honestly, with all due respect to our beloved governor and I mean, I'm not political. I don't want to get political, and the members of the congressmen and women. There's really literally no thinking behind this. It's effectively they say, well, we just want to discourage you to have on Denti-Cal, and over 30% of Californians are on Medicare.
Yeah.
One third, more than one third of California are on Medicare. So it's a huge thing, and mainly it's not going to affect necessarily as many people in LA or San Francisco or major metropolitan areas, because it's going to affect them, but not as much, because there are always going to be some dentists here and there. But places like Paso Robles or a little bit more remote, the smaller communities where we go, it's going to have a major effect. We would love to continue accepting. The problem is that if we cannot afford it, that means that because my dentist, the dental associate, they see patient, in order to convince them to move, typically they're not local, they come another city. One, she's working there, she came from Chicago, the other one came from San Francisco. So these doctors, you have to pay them in part, if not better than the private practice, to get them work with us. And once they see that reimbursement fee, they say, well, I'm not sure if I want to continue doing that. So they get unenrolled. Then suddenly, instead of having 4 doctors accepting Denti-Cal, now I'm going to have potentially 1.
Right.
So anyhow.
Yeah, I mean, I'll see it, and you can agree, not agree, but I don't think we're being represented very well anymore, and that's just my reality. That's how, and somebody who doesn't watch the news, it's like that's what it feels like sometimes,
100%.
right? You go around doing certain things, you're like, wait, why is this way? And then nobody really has an answer other than, oh, that's what was voted. That's what was pushed forward.
Right.
I know that my kids in kindergarten, and I start thinking about, okay, now I got to think about schooling, like what's going to go into that, but yeah, no, Paso is so small. Any change in taxes and stuff like that, you can feel it. You can feel it in
Sure.
Paso. Was there a moment where it felt like, oh, everything was good, and you're like, as far as like insurance wise, like there wasn't really a lot of friction? I'm just curious about that point in life, and can we get back to that? Do you think there's a road to it?
I mean, if I I think so. I mean, I think there must be smarter ways of doing that. Listen, I do understand budget. Have a business to run, so I understand when you can't spend the money you don't have. I'm fully on that. I'm not saying, but you also have to put your priorities again. When I think honestly, for somebody who wasn't born and raised in California, I was blessed to live in different countries and different states. When I first moved to state, I was in Illinois and moved here. I love California. I think it's home. My kids grew up here, and we're gonna retire here. The problem is that we spend too much money on putting too many red tapes everywhere, and then places that we need to spend money, we don't.
Yeah.
And there's so much waste. There's so many layers. It's just everything is complicated. Not as much in dentistry, but in medical. Why our medical system as a whole in the country, I'm not talking about just California, is the most expensive per capita in the entire world. It's not. It doesn't make sense. It's definitely not the providers are making. It's not the providers are making money, and I'm not saying that they don't deserve. You could be a heart surgeon, you make tons of money, but that's not where the bulk of money goes. The money goes to many middlemen in between,
Yeah.
and they have lobbyists, and it's very hard to, and it's very hard to change them. And so long as that exists, there's so much money is wasted in other things. Unfortunately, the regular people that they really deserve it, because you think about when the patients or people, they don't get oral care. Children, they can miss school. They're in pain. Even if cosmetically they're missing teeth and broken and mug, is just self-confidence
Yeah.
affecting their systems, affecting your heart, affecting, you can have affecting systemic like diabetes. So many things that you start from there. That's why I'm saying there's no thinking. When the entire dental budget is 1.5% and they want to cut at least 30% of it. So 30% of a 1.5% is 0.5%. Yet they can't go and cut some of these middle people that absolutely to me is useless. But anyhow,
One of the things I like to think about is like today's technology is allowing us to reach people in more ways than we thought before, right? Podcasting itself is a way to inform people. What would you tell people if they told you like, okay, how do I help make the change? Like, how do I help one keep myself healthy through my teeth, right? And then two, like actually affect how our future is going to look like for getting this basic, pretty much healthcare.
well, that's for sure. I mean, obviously, it starts self-care at home, right? Because less you need it, better it is. And if just you
Yeah,
go for a checkup, right? I
yeah,
mean, love to see sometime, the kids, and happens often enough. The kids, they come, and every 6 months we see them and say, hey, yeah, no decay, no cavity is good for you, and that's fantastic.
yeah,
But also we have to be pragmatic and realistic. Not we can we always do continues to promote and encourage in prevention and home care and good oral hygiene and good nutrition, good habits. You can say all of that, but also myself, I'm a human being, and we are not perfect. Gonna have that thing that we're gonna have a little fiesta here and we're
yeah,
gonna eat. So there are things happen, and I don't think that dental insurance should be a, a conditional. It should be it has to be available to everyone. I mean, you can't say, well, we're gonna cover your ears, your nose, not your teeth,
yeah,
not your mouth. But what do you mean? Is that foreign? I mean, is that somewhere else? I mean,
yeah,
there's a lot more changes and actually, basically trauma that happens to the mouth than it happens anywhere else. So this is just a lot of old thinking, unfortunately, not smart thinking. But and honestly, if when it comes to this specific, that Californian potentially they might lose or at least limit their dental coverage through Denti-Cal. I mean, this is not something that us dentists voted for.
yeah,
The people that voted for are the politicians. Politicians are basically elected by people. So collectively, we have a voice.
yeah,
We have power collectively. I think they just have to contact their representative, right? I mean, the assembly members, the Senate members, the senators, and maybe the office of the governor say, this is not cool. This is not right. You're not, what you trying to save is actually not going to happen in terms of really saving, because a lot of those patients, don't forget, they're going to end up in emergency rooms too. If you don't have coverage, if you have to wait a month and a half to be seen,
yeah,
either you have to go and pay out of pocket for, but that kind of defeats it. These are people that they're in need, they don't have the money. So they're going to end up in emergency room because that's covered. So what happens, emergency room, they're going to charge that to a state. So I would argue, in fact, if you really think about it, it's going to cost more. I'm a taxpayer, we're all taxpayers in California, and I want to have a, balanced budget. And
yeah,
I'm not saying, oh, let's go and just go ahead and spend money. No, that's not the case, but let's do it the smart way. Because when one visit of an emergency room equals at least 10, if not 20 dental visits,
yeah,
checkmate right there. Plus, if a person doesn't come to work, productivity goes down. If a patient, if a child doesn't go to school, it's not right either. What are we building? So These are the things that I think the only way they really can help, beside taking care of themselves so they need less, is really, putting some pressure on our politicians.
Yeah, I 100% agree there because there's been, I mean, this is a smaller scale. The parking downtown Paso, I don't know if you ever heard about that conversation, but
Yes,
everybody put in their signature and got rid of it.
that's fantastic.
That's
Yes,
like in a small scale of what could
100%.
happen, especially
Yes,
with Denti-Cal.
absolutely,
Yeah.
absolutely, absolutely.
Yeah. Are there any final messages you want to say to the audience on, for those of you, for those of the people who, one, where can they find you? How can they reach you? And, you know, I've learned a lot today.
Well, I appreciate it. But thank you for giving the opportunity to talk about this, and I really enjoyed it. As far as finding us, is CaliDentalSmiles.com. I think that's the once you go there, we have we also have another location in San Luis Obispo, not too far. That was actually the first one when we came to San Luis Obispo County. We have a couple of locations, but farther south in the Central Coast and more in Monterey. But my final message would be, beside having the good oral hygiene, I think as a dentist, is my duty to always encourage, basically, the brushing at least twice a day and the flossing once at night before you go to bed. Easy on sugar intake and
Mm,
nothing too harsh and crunchy. But also, as far as when it comes to Denti-Cal coverage, and I'm saying it's not just people that are on Denti-Cal, it's for everyone. For the reason I just mentioned, it affects all the taxpayers. If you're
mm,
an employer and your employee cannot show up because have dental issues, you lose. If you are a instructor, you are a teacher, your kids, they're not showing up, you lose. But if you're on Denti-Cal, of course, 100% I can tell you, if and the funny thing is happening kind of hush hush, this thing, nobody's telling anybody. But when I told the patients, said, really, we didn't know that. They said, well,
mm.
that's when happening. Prop 35 was approved, we still don't have it. In 2024, it's not implemented. There's always, oh, well, the tax things, I don't know, I'm not a politician, I'm not a tax person.
Yeah.
Well, we cannot do this because of federal money and this and that, but there's always a way. If there's a will, they just have to, I would say, the population, they have to come together. They have a loss of power. The real power is in the people. We, the people, have to act. We have to contact the politicians and let them know about this. This is basically something that's going to happen. Unfortunately, I mean, we're gonna love to continue. We would love to be able to accept it, and I'm never gonna say no. But the problem is that if I don't have enough doctors accepting that, because not
Mm.
just me
Yeah.
as the providing care, that means longer wait times, not available appointments, many things that you don't wanna wait for that. So that will be my final message.
Yeah. Yeah. Go Dentical for sure. Like,
Yes,
yeah, go learn more about it if you don't know enough about it. And then obviously they can reach you and pay you a
absolutely,
visit, talk to your
absolutely.
staff, and learn more about what
Yeah, we
this.
have their,
Yeah.
we have all the, representative of the areas. We have their,
Awesome.
internet. We have their sites. We have their phone numbers. We have their, email addresses.
Do you get on TikTok at all?
Yes, actually,
Okay.
on TikTok, actually, I'm new all this stuff.
Yeah.
So, but on TikTok, which is Dr. Azad, and was anything else that, so Dr. Azad, DRAZAD.
Okay.
That'll be on TikTok. You can see, I talk a little bit about this as well, and we call to action.
Okay. Perfect. Thank you so much, man. I'll make sure I include everything in the
I
descriptions too.
appreciate that.
Yeah.
Thank
Awesome.
you.
Thank you.
Thank you.